Welcome in, Dr.
Thanks.
Cody
What's up?
Gioia, right? Am I saying that right?
You got it right.
You got a
Yeah.
tricky name, man. Lots of vowels right in a row. My last name gets butchered all the time, so I try to get people's names right.
Just tell people Dr. Cody.
Dr. Cody, it's easier.
Try to do that.
Yeah. All right. So Dr. Cody here, 919 Spine, chiropractor, chiropractic medicine, and several office locations, right?
Correct. We have offices in Holly Springs and Morrisville right now. Eventually looking to do a third office in Wendell, probably by first quarter of next year.
Okay. Congratulations.
Thanks.
That's awesome.
Yep.
So expanding and growing.
Slowly growing. Yep. Absolutely.
Right. How did you find that this was your field and your passion and path?
So going way back, I guess my first experience with a chiropractor, I was in seventh grade playing football. Had a back injury. I woke up one morning, I couldn't run. It was extremely painful for my back. I could not practice anything like that. Ended up seeing a chiropractor for 2 visits and really got me better. And I haven't had the problem since. So that was kind of like my initial exposure with chiropractic. But I was actually in school, undergraduate. I was actually directed towards physical therapy initially. So I was working in an outpatient physical therapy office for about 2 years. And then I was doing some, obviously clinical stuff, mostly focused with orthopedics, but also looking at neurological vestibular stuff with physical therapy. And coming to think about it, I really liked the more hands-on manual stuff that they were doing, more so than just taking somebody through like an exercise program and just kind of following around and doing that type of thing. So I really started looking at chiropractic again, and instead of applying to PT school, I actually went the chiropractic route. I liked what they did. I liked some of the things that their scope of practice encompassed. So I ended up getting into a school up in upstate New York. It was called New York Chiropractic College, but it's now called Northeast College of Health Sciences because they added a couple other programs, like they have a doctorate in nutrition program. I think they have a couple. I'm trying to think of the other one. They have acupuncture there as well. A couple other programs there. So they kind of did a rebranding and change of the name. So
you really have to know a lot about the body, and I mean anatomy, physiology. I've often reflected on that vets and chiropractors, I think, know more about the workings of the muscles and skeleton and how everything moves and operates.
It's interesting in the sense that it does encompass a lot of different things. For example, it's almost 4 years of school. I find that people are surprised to find out all the stuff that we learn from a credit standpoint and a credit load. The school that I went to went by trimesters. So it was 10 trimesters, and usually you're taking anywhere from 25 to 35 credits at a clip per trimester. So it's really 5 years of schooling kind of crammed into like 3 or 4 years. And we do take 4 separate board exams as well. So it's not just one single board exam. We have 3 written and 1 practical board exam. So I wouldn't want to do it all over again, let me tell you that. But no, it definitely a lot of different things about the body rather than just your basic anatomy and physiology type stuff.
You do have to do some of it, not all over again, but you've got to keep up with that education.
Yeah. So that's like you graduate school, and I always look at, and somebody told me like about like lifelong learning. Mm-hmm. Your education just starts whenever you're getting out of school, because there's so much that, obviously school's taught you, but so much you don't know coming out of school. And it's, I'm sure your profession is the same way.
Yeah, indeed. Yeah, we have ongoing continuing education compliance requirements. Yep. What I have also always appreciated about chiropractic medicine is that you're really like treating the problem or addressing the problem, not just masking the symptoms so much. Like drugs and pharmaceuticals, I get it. Like there's a value, there's a need, there's a time and place, but I feel like this is much more, let's go to the source of that issue, not just cover what it's causing.
Correct. Yeah. I mean, you traditionally hear that chiropractors try to assess and get to the root of the problem. I have a patient that comes in with shoulder pain. Well, a lot of times, and this is nothing against any other profession, but you might have another medical professional looks at it and is like, oh, it must be something with labrum, rotator cuff, bicep tendonitis. And I get to poking around there. I start looking at the biomechanics and just how the shoulder girdle is moving. And you find that there might be other muscles in the area that are tight, that are causing some issues and causing these particular muscles up here to kind of work harder to get that shoulder to move the way that it should. So really, we kind of assess the whole big picture with it, rather than, just because you're having pain in that area, it has to be coming from that area. Because a lot of times I'll poke around and I'll find that, you get what is called referred pain, and you might have that coming from other muscles that maybe aren't even necessarily in that same area, and it's causing you pain there.
From a youth baseball coach, I can speak to the pain in the shoulder and the elbows and the usage injuries. Is that actually something on that note that you're seeing more of, is kind of usage or overusage injury in youth? Because of the
sport? I mean, I recently, I do see like a lot of like young gymnasts and dancers and stuff like that, and their practices, I mean, they are anywhere from 8 to 12 hours at least per week of practicing, and obviously pretty rigorous routines and stuff like that. Coming in with injuries that they probably shouldn't have until they're in their 40s and 50s and stuff like that. And these are 12-year-old girls, you know what I mean? So it's like crazy to me, like little things like that you're seeing. And I feel like we had this conversation earlier with youth sports. I mean, there's a lot more, routes, I guess, as far as personal training, and things that these kids are doing nowadays. And they're training a lot more like D1 athletes rather than just youth baseball or exactly
that they are. Mm-hmm. And back in my youth, sports was seasonal, meaning like played baseball in the spring, soccer in the summer, swimming, basketball. There was a rotation, and now it's like, no, we're going to concentrate on just this to, that puts some stress and then doesn't build other muscles and skills, right?
I think you are seeing more parents gravitate to one sport at an earlier age and just sticking to that sport and hoping that their kid is that, the answer at that sport, rather than being the age where they go out and try a bunch of different things.
Well, side note, parents, most college athletes are actually multi-sport athletes.
True.
Now, there are also incidents where there is not just overusage and constant usage, but an actual like acute injury incident that you're also probably
absolutely. I mean, I have, the typical, we're attached to a CrossFit gym. So you will have an occasional weightlifter with, an acute disc problem where they went to pick something up, they felt a twinge in their back, and they're on the floor.
Yeah.
So I've had people crawling into the office, like little things like that. Absolutely. Or somebody who's playing soccer, they roll their ankle, it swelled up like a balloon. How do I manage this inflammation? Mm-hmm. So we do see a fair share of that, but I am seeing a lot of chronic overuse stuff.
Car accidents?
Periodically, I think I have 2 on my caseload right now. We definitely see a little bit of a flow of that, which is fine too. There's a lot of chiropractors out there that will typically market just for car accidents. Okay. We're not that type of chiropractor, but I'm not going to shy away from seeing patients, that are obviously in a car accident. Tech neck is huge.
Yeah.
Especially with the younger population too, you're seeing more and more of them. So I'm curious to see how they progress in 30, 40 years.
Because some of these issues build with age and time.
Yeah. And I'm seeing this curvature of the spine in youth, like a lot younger now, you know what I mean? So I would guarantee that 30, 40 years down the road, it's good job security for me, but they're going to have a lot more issues than maybe even you or I have.
Mm-hmm. Now, the spine is always sort of the typical symbology of chiropractic, but you do whole body. I mean, you mentioned the ankles and everything's connected and radiates.
Absolutely. So a lot of people don't know, we do have a newer chiropractic profession, as far as like the studies of chiropractic now are really trained in the extremities. So I do know a lot of orthopedic testing for, shoulders, knees, ankles, whatever it may be. And we do have treatment methods for that as well, rather than just kind of targeting the spine like everybody thinks.
And plantar fasciitis, sciatica, things like that are all kind of issues that people suffer from that chiropractic can.
Pregnancy is another one that people don't really understand too. A lot of women will struggle with either sacroiliac joint pain or sciatica with pregnancy. Also, brown ligament pain is another big one with pregnancy patients. So we do see quite a few of those as well. It's actually, we have quite a list of things that we can actually help. And I'm the type of person, that I don't think that everything that's going to come into my office that I'm going to help. We are a conservative method of treatment. So I realize that I'm not going to fix every single thing that comes in the door. But kind of
it's not surgery. You're not opening it up and cutting.
Right. We're minimally invasive. Minimally invasive. I say minimally invasive because we do dry needling. But Yeah, but it's my job as a chiropractor, to kind of triage you and point you in the right direction. If I can't help you, here's the next best thing.
Okay.
And I will do that if I need to.
All right. So you just mentioned, don't want to pass over the dry needling. You also have talked about several other cupping, scraping.
Yep.
Talk to us about some of these things that people may not
Okay. So
associate
yeah,
with.
we kind of do a lot of different soft tissue techniques in our office. We do cupping, instrument assisted soft tissue mobilization, or what people call scraping. We do dry needling. I incorporate rehab exercise. I do some active release techniques with the muscles. So a lot of different things. And going back to what I was telling the group before, we have a lot of different tools in our toolbox, and adjustments are great, and that's kind of what people think. The cracking, it's kind of our wheelhouse type of thing. However, and it helps a lot of things. It helps with general mobility, but it doesn't help every single thing that walks in the door. So we have a bunch of different tools in our toolbox, because if it was just one thing that kind of would help you, it would just be the answer. So I tend to throw a bunch of different things at you. We kind of figure out what works from there, and we kind of tailor your program to kind of what's working for you. So
Do you find that if somebody does have kind of an ailment, the longer they let it go, the more likely it is to be permanent, where if we sort of try to jump on it early, we might be able to correct or address.
And it may not be so much permanent, but the longer that they wait, that inflammation just keeps building and building. It's usually the longer it takes for them to get back to where they need to be. So yeah, I do have patients that literally come crawling in the door, and it's like, when did this happen? Maybe a week ago, and it's gotten worse and worse. I thought it was going to get better. Well, if you would have saw me maybe 3-4 days ago, we wouldn't have got to this point, but you decided to kind of wait it out a little bit. So little things like that. And then if that, you might have saw me a few days ago, and I might have treated you once and it got better instantly. Now I got to work on you the next probably few days to try to get it back to where you need to be so you can do what you want to do.
Is there a point where, okay, we've tried this approach, we've treated it for a few weeks, where you're like, hey, this might not be the right approach? Because that has been something that I think has hung people up, is that, oh, well, they're just going to want to keep treating me forever without seeing the real marked improvement.
So general rule of thumb, and obviously conditions vary with how long they can take to kind of get better, but general rule of thumb is I should be seeing some sort of remarkable improvement at 4 to 6 visits.
Okay.
If we are at visit 4, 5, 6, we're not seeing at least 30, 40, 50% improvement, I'm probably not the answer for you.
Okay.
And like I said, going back to what I said is, I understand I can't fix everything. However, at that point, it is my job to say, hey, maybe we need to do this. I either need to change what I'm doing. We either need to get more testing, whether that be diagnostic testing, imaging, whatever, or I need to point you in the right direction, say maybe physical therapy, maybe an orthopedic doctor, so it usually goes to that after that.
Okay. Well, if somebody is ailing from something or finds himself in need of a chiropractor, how can they get in touch with you? What's the best way? And then what is the process for the first appointment?
So typically it's just a phone call.
Okay.
We don't do online booking, only because we were finding with online booking, people were having trouble differentiating what type of visit they were, whether they were just a routine follow-up. For example,
might not know. Right?
Somebody might book a follow-up, but I got X, Y, and Z going on now too, and they add stuff, so like we weren't getting enough time to help them to do our exams and things like that. So probably the best way is just to call 919-342-0900.
Okay.
We do also have a text line too. So if you become an established patient, you're more than welcome to, we have a text line. You can set up your appointment that way, say, hey, I have this going on, when can I get in?
Okay.
Type of thing. And then anybody who has any questions, my email, drcody@919spine.com.
Okay. And then somebody is coming to establish care, they've got a problem. What is the process? How do you diagnose and figure out and then begin treatment?
So, we set up the initial appointment is usually obviously an exam, but we also treat on the first visit as well. So I do a full exam on you, and that includes everything from orthopedic testing to neurological testing to maybe functional movement assessment. And then once we have an idea of what's going on there after talking to you and taking your history, then we work into a little bit of a treatment. I usually baby step on that first visit. I don't throw every single thing that we do at you, usually because that can make you really sore, and your body might go into shock mode after that. So we kind of baby step you on the first visit, get the ball rolling, and then usually, depending upon what you have going on, say you're really acute type of thing, I might have you come in the next day. But usually we give it a few days after the first visit and go from there. Based upon how you're feeling, that usually kind of dictates the plan moving forward. I always tell people, we kind of almost really reassess at every visit, meaning if I can get you better, next visit you come in, you're feeling great. We can start to space you off more from there to more of like an as needed maintenance type of thing after that, whatever you want to do from there. But like I said, there's always that line that I cross, and it's usually like at the 4 to 6 visit mark, we're not seeing any single improvement at all. Then it's probably time to figure out another plan.
But that first one, kind of like jumping into the gym the first time, long term it's going to help, but you might feel a little bit the next day.
Mm-hmm. Yeah,
possibly. So need some time to sort of recoup.
Yeah. And I always it's also injury dependent. Like I don't have people going, a lot of people, that's the main question people ask me, especially like the weightlifters and stuff like that. You think I can work out today? And it's always, it's very dependent. You know what I mean?
Yeah.
Like I want you to get back to doing what you want to do, but understand, I'm not going to stop you from doing what you're doing, and as long as there's no red flags. So if you want to go out to the gym,
have you found red flags in a first appointment? Like, hey, you really need to.
Oh yeah, and there's a lot of patients. It's funny because there's people that are just go, and I'll say, hey, I don't want you to do any sort of overhead lifting, or I don't want you, doing a lot of hinging at the hips or anything like that. Watch your bending and stuff like that, or watch lifting anything heavy off the floor. And then I go out in the gym 3-4 hours later, and I see a person out there doing exactly what I told them not to do. So it's like,
that's how you got that way.
Yeah, and then you got to understand that your things may take a little longer to heal. If you're kind of out there doing, it's great that you're out there moving around, and I want you doing that, but sometimes that can kind of work against us a little bit and hinder your progress.
Movement's critical, but the right kind of movement.
Correct. Yep.
Yeah. Well, speaking of, what do you do to stay active and
So I like to lift a lot.
Okay.
Yep. I'm more so a lifter. I do a little bit of running here and there. I will say I like to lift more than I do like to run.
Okay.
With kids, I have twin daughters. 3 years old now, so getting them outside and showing them to be active has been the big thing, but it's also decreased the time for myself to want to get into all that other stuff. But
probably still lifting a whole lot.
Absolutely. Yeah, but mostly just weightlifting right now as far as activity goes. Occasionally I like to do a little hiking and just trail walking, whatever, but that's pretty much it.
Golf?
Do you like to golf? Yep.
Nice.
Absolutely. Again, my time for that is kind of decreased a little bit, but I try to get out there at least once or twice a month and try to get on the course.
Is that another one where you see some folks coming in from that constant?
Correct.
Work on the back is not the best in golf.
Yeah. I'm actually looking forward. I'm going to be taking a course through Titleist called Titleist Performance Institute to try to assess movement of golfers, look for different pathologies with their swing and things like that, and show them, rehab exercises, stability exercises to try to improve their swing a little bit. So that's something I look forward to in like my Con Ed within the coming year.
Okay. So. Excellent. So office locations right now are?
So currently I am in Holly Springs full time.
Okay.
I'm there Monday through Friday. We have another location in Morrisville. Also Monday through Friday openings there. And we're open from 8 to 4, at least 4, maybe even 6 every day, depending upon the day.
Okay. And then coming soon, there's
Wendell. We have a third doctor. So it's Dr. Matt, myself, and Dr. Beck. Dr. Beck is currently in Morrisville full time right now, but he looks to start over in Wendell probably by March, April of next year. That's what we're looking at.
Okay. So you, Dr. Matt, both go by first name. Dr. Beck, I assume that's a last name.
Yeah, actually, it's funny. Yeah. I never really thought about that. I think it's the last name. Yep.
All right. He's got a simple one. Now, Beck, you can't mess that one up.
You can't mess that one up. Exactly.
Find more information online, 919 Spine, pretty easy to remember.
Yeah, just not 911.
Right. Yeah. Get you the wrong place.
919spine.com. Yeah, they have a lot of different information about, kind of what we do, how we kind of differentiate ourselves from other chiropractors in the area. We have a lot of blog stuff on there. So certain stuff that we try to keep updated a little bit with that. And then if there's any other questions, shoot us an email.
Okay. And then I'm sure they can find it online, the phone number, but one more time, what is the phone number?
919-342-0900.
All right. So Dr. Cody with 919 Spine. You can find him online, 919spine.com. Appreciate you being here.
Thanks. Appreciate it.
Absolutely.